Mhm. So today we are starting a new module which is called Parents and Young Children. This is Unit 7 from the book. And I would like to make it full screen. Well, so as you see, yes, can you see it full screen?
No, ma'am.
No, ma'am.
So let us just move here and so can you see it full screen now?
Yes, ma'am.
Okay. Well, and so here you can see pictures. So, and the task is to answer the question, what is happening in each picture and how do the adults and the children interact here in these situations? What can you see?
In the first picture, they are getting down of the vehicle.
Mm-hmm. The mother and her child, okay. Mm-hmm. And
in the second picture, the doctor and the parents are discussing about the child's condition while the child is busy with her games or drawing. They're trying to divert her mind from this current situation by giving her some other task.
okay. And what about interaction of children and adults? In the first picture, how does is the child at ease? So in this situation, does the child feel safe?
Yes, ma'am. In fact, both situation, the child is calm and the child feel calm and composed, ma'am. Like, since they are with their the child is with their parents and also they're taking care calm, so they are not feeling any complications right now, ma'am.
Mm-hmm. Yeah, so it's very important just to be with the mother. Okay. So, and in these pictures, so in picture C, who would like to comment?
In picture C, the child is taking an injection. Nurse is giving injection. He's crying and his mother is holding him tightly. The children will be afraid of injections and they will be crying. So a mother can hold them and they can comfort them.
And the child can see the syringe, the instrument. Yes, that is why he is intimidated. Okay. So, and then in picture D, we'll speak about picture D.
In picture D, we can see that a student is sitting there who cannot walk a years because he is sitting in a wheelchair. And there is a doctor, and I guess his father is sitting nearby the doctor and asking detailed about his diseases.
And how does the child feel?
He just didn't get anything. He's just looking both of them. What are they discussing about?
Is he worried?
Yes, ma'am.
Maybe he is worried because he's rather just mature, right? He's a big boy.
Yeah.
And what helps him just to feel safe in this situation?
And while parents and doctor is talking, they can take the patient outside of that room, or they can take the kid away from this situation so that the child may not cannot feel anxious or doubtful or curious about what they are talking. The patient the child cannot understand what they are talking now, since he is a small child. He cannot understand, even though he is bigger. He in this particular age, the child feel curious and anxious about their talking, since he is not infant. So it's better to take the child outside the consulting room while they're having the discussion.
Exactly, and you can see a toy car so near him, right? So just he has his toys just to feel safe and comfortable. And in picture E, what is happening here? In this picture, yes.
The patient is very sick, and the bystander or the relative is also very tensed and very doubtful or very scared about his condition, what will happen to him or her. So the patient is unconscious and doesn't know what is going through him or her, but the bystander or the relative is highly tensed and scared of the situation. Stressed also.
Okay. Yes, anyway, so in all these situations, the parents are very close to their children, and so they just are ready to help, to explain, to calm them down. So it's very important, and you can see that when a doctor deals with the little children, so they have to interact also with their parents, so the pediatricians. And if we move here to the next slide, there is a question about the environment. So the environment for treating children needs to be made different from that for treating adults. Why? And how can we make it different? Is Asna here? Asna? Hello, Asna? No, Asna is absent. So, Shamisha?
Yes, ma'am.
So what do you think of the environment? Can you comment on this?
Yes, ma'am. Both adults and children are different from each other because their mindset is different. For children, they will be more comfortable with toys and some kind of play, while that the adults may be very free if they are mingling with their own peer group. So if we allow the children to play some kinds of toys or chocolates like that, they will be more we can treat them very easy. For in case of adults, it will be not very easy to try to mingle with them. And
Okay. Yes, so just some special environment for children with toys, so they can be able to play. Okay, Ranisha, can you add anything? Is Ranisha here? No, she's absent. John Farvin? John Farvin. So, John Farvin?
Yes, ma'am.
So do you have anything to add? Okay, if we think about the, for example, the colors that surround children in a special ward, like for children, so should there, for example, the colors be bright to distract the attention of children from something unpleasant? So is it a good idea to, for example, color the walls with bright, just make them bright, different colors? What do you think?
Yes, ma'am. I think it's a good idea to color the walls with the bright colors.
Okay, so does anyone have anything to add?
Yes, ma'am. I would like to add that in the case of adults, they are more mature, so they can understand the situation, and they can have a mindset to cope up with the situation. But the infant or the child may not have that situation. They will get scared by even seeing a small needle. So we in order to take care of that situation or that mindset of that child, the rooms are filled with toys, and the walls are given bright colors, so the atmosphere will be not scary. It will be more friendly and lively to the child or child. So they may not feel scared if the walls are white and fully filled of the some anatomical charts and all. The child may feel scared even by seeing it, that only.
Exactly.
But in case of adults, they are not scared of that situations. For the children, this kind of environment is safe.
Yes, you're right. Okay, thank you so much. Good. Now, so there is some statistics here about the situation in the United Kingdom, as you see. So you see that patients who are less than 15 years of age make up 20% of the average GP practice in the United Kingdom. 20%. And those, the under fours patients consult their GP more than any other age group except the elderly. Of course, children under 4 and their parents. And so is the pattern in your country the same? I mean that, of course, we don't know the exact statistics about our countries, but how do you feel? Is it the same? Is it similar to the situation in the United Kingdom? So let us listen to Sultan. Sultan, is Sultan
Yes,
here?
ma'am.
Yes.
Yes, ma'am.
What would you say?
Almost same, ma'am.
Yes, why?
Because the chances of getting illness for the younger age people are very increasing day by day. That's why.
Yes, a lot of infectious diseases for young children. Yes, so does anyone else want to say something?
Yes, ma'am, it is like almost same, because mostly these people get sick because they have low immunity. Basically, mostly younger children, the most younger kids and the elder peoples are having less immunity. So and also they play, younger children also play very freely when we are leaving them outside also. So certain dust, smokes, etc. can also cause certain diseases for them. So there is a chance of increasing the sickness for them. So there is a need to go for hospital.
Yes. Okay, thank you. Well, and so if we, in the previous slide, there was idea about how many that the younger children just go to their GP more than elderly people. And so in this connection, which areas do you think should have priority in any modern health spending? For example, child health, geriatrics, or technology. So which age group should be given priority, or should we give priority to technology, to the development of technology, and the government should spend more time on technology? So if you compare these groups, which group is more important? Now let us listen to Danish. Is Danish here?
Yes, ma'am.
So what do you think?
Basically, we need to give priority for all of this, but especially for child health. That is because they are the growing generation that are upcoming. And also for geriatrics, we need to take care of our elder ones, and for technology also.
So
we can improve our health condition through technology, through different.
yes, and help all the other groups, all the age groups. Okay, so Ashwati, what do you think of it?
Yes, ma'am, I do think it's child health because they are going to be like the people who are going to lead our life future. So they are also going to create miracles in the world. So I think children need to be given more priority, and they also have less immunity, and they don't have a good maturity to keep to understand the situations and behave like that. So I think the place should be more clean, so that we should spend more in lot of monies.
Does anyone disagree with this?
I think the 3 part also should be given equal priority, ma'am, because when we talk about patients and health, either it is a child or a old age people, they both are equal in when we see it through a doctor's point. So talking about child's health, we can say when a child is just born or is only 2 or 3 years old, he has some difficulties to speak about his health. He don't know how to explain himself, so it will be tough for the children. Likewise, when we talk about the older people, when they are about 70 or 80, they'll be facing the same issues. They can't speak, but they also don't know how to explain their situation. So in case we have to give priority for both of them. And talking about technology to give better treatment for them, for the children, or to the older people, or to the middle ages, for that the technology should be there to a level. So I think all the 3 should be given equal priority.
Very good analysis. Okay, thank you. Well, and we move here. So let us focus on some vocabulary and speak about qualities of a good pediatrician, a doctor who deals with the young children. Here we can see the table with the different adjectives. There is a column for positive adjectives and negative adjectives, and they are given in pairs. And we should complete this table that describe the qualities of good pediatrician. For example, so in the first line, we can see the positive adjective is patient. What is the corresponding negative adjective to this?
Impatient.
Impatient. Yes, we can use the prefix impatient. Please, I would like you to write down these adjectives because we'll need them later. So please, just 2 minutes for you to write the adjectives in pairs. Okay, start please. Well, so let us listen to one of the students to read all the adjectives here. And so let us listen to Taib.
Yes,
Taib,
ma'am. Yes, ma'am.
read them, please. Mhm.
Yes, ma'am. The first one is impatient.
So read them in
The
pairs. Patient, impatient, then
and the second one is confident.
and diffident
And
or
the
nervous. Mhm.
yes, and the third one is inefficient.
Okay,
And the fourth one is unreliable.
unreliable. Mhm.
And the fifth one is insensitive.
Okay,
And the sixth one is dishonest.
yes, honest,
And
dishonest.
the
Mhm.
yes, ma'am. And the seventh one is respectful.
Okay, respectful, disrespectful. Okay, good. Now, let us look at the slide here. Here there is an exercise, there are sentences, and we should complete them using the appropriate adjectives from the table. So there are several situations described in each sentence. We should understand which adjective can better describe the behavior or the quality of the person described here in this situation. So, for example, the first sentence, let us listen to Labib. Is Labib here? No, Labib is absent. So, please, Hepsiba.
Yes, ma'am. Dr. Mansoor is very rash in everything she does. She prepares for her ward rounds methodically, and everything is where it should be and in order. Dr. Mansoor is very honest in everything she does.
Very honest. Or can we use another adjective here? So, yes, we can say she's honest.
Efficient.
Efficient is better. Yes, she's very efficient. Yes, so please read the other situations and think of a better adjective for each situation, please. 3 minutes for you to do this.
Okay.
Are you done? Let us listen to Ansila. The second sentence, please.
Dr. Mubarak is a very reliable sort of person. He does things quickly and he often makes the parents and sorry ma'am, different sort of person. He does things quickly and often makes the parents and children nervous by showing that he wants the consultation to end.
Just a minute. Okay, yes, the connection was bad. I just didn't get what did you use.
Can you hear me now?
Yes. Mhm.
Dr. Mubarak is a very diffident sort of person.
Diffident.
He does things quickly and often makes the parents and children nervous by showing he wants the consultation to end.
When a person is in a hurry, it's just he wants the consultation to end. So, which adjective is better to use here? So, yes, any more ideas? Who can help us?
Impatient.
Impatient, yes, is better. Okay, thank you. Well, Asna, please, the next number.
Dr. Ma'am,
Yes.
Dr. Andrews is very respectful to all patients. He greets them properly and takes the wishes into account.
Good. So, Shamisha?
Yes, ma'am. Dr. Chandros is not very honest with himself. He finds it difficult to admit his weakness while showing off his strength. Being realistic about weakness helps us to learn and develop our skills.
Yes, it's very important to admit our weaknesses. So just to develop and to learn. Okay, so the next is Shamisha.
Yes, ma'am.
Ramisha. Now, Ramisha. So John Parvin. Hello, John Parvin. Hala Malik.
Yes, ma'am. Fifth.
Number 5.
My colleagues can be very insufficient. My colleagues can be very sensitive. She annoyed the patient when she referred to her husband, and she wasn't married. The patient was quite upset. Insensitive, ma'am.
Insensitive. Good. So Sultan.
Yes, ma'am. It's not easy to feel confident the first time you do something new, but with practice you begin to feel very good about it.
Good. And the last one is for Sinju.
Dr. Kamara sensed that the team thought she was diffident because she let them down. She made mistakes on the ward and was late on several occasions.
Diffident, and what are the other adjectives which are possible to use here?
Unreliable.
Unreliable, yes, also. Okay, so you see, so different attitude of doctors to the situations, that happen in their practice, and the task here is to make a list of other qualities you think a good doctor, not just a pediatrician, needs to have, and say why each quality is essential. what can we add to the to the list of qualities that we've made just previously? So, who would like to speak about other qualities?
Accuracy is very important, and timing is also very important for a doctor, because if he is attending to his, even if he is attending through his wards irregularly or inaccurately, there will be problems with patients, and the patients will be distrustful towards the doctor, and they will lose their trust towards the doctor.
Okay, great. So, any other qualities?
Should be punctual, ma'am.
Yes, it's very, very important. It's why? Why do you think it's good?
Ma'am, if a doctor is not punctual with his work, the first error he or she may take is while recording the patient's data. If the doctor is not punctual and he is doing at last of this schedule, all the data can be mixed up, and one condition may be mixed with other patients, and total complications may occur. And also, the doctor is not punctual with the routine of the patient. If he didn't check up his more in the morning and he goes for the checkup in the afternoon, it also affect the patient health conditions.
Okay.
So
The doctor must be also friendly with the patients.
Yes.
Most important. Because they should know how to interact with the child. For example, a few weeks ago, a video was released which showed that a child was taking the COVID vaccine, in which the doctor was trying to please him. He was trying to play with him. Actually, he was playing with him with the needle, that he couldn't notice that he was actually injected. He has actually undergone the injection. That's how a doctor should be. The doctor have to mingle with the patients so well, so that there will be an easy way to treat that child.
Exactly, you are right.
And the doctor should have an insight, because the children don't know what they have to play. Sometimes if they play with scissors or like that, it will be very danger for that children. So the doctor should have an insight to the children in
Okay. Good, thank you. So we understand the difference between being just a pediatrician and just a doctor for adults. And yes, so we have about 1 minute left. So it makes sense to take a break now. Yes.